that.
Yep.
And then I'll go to Dr. Beni.
Since he's the psychiatrist here, so he's going to lead most of the discussion.
Yeah.
Oh God.
Give all the difficult questions to Amer.
Okay. Yeah. I thought I'm going to put one to save me.
Doing this tonight's program.
Okay, how do I see the comments?
I'm hearing that the earphone is better. Is it for the?
I don't know. I don't know how you guys are hearing it, but I can definitely hear you guys very clear.
Okay. All right. I think we are live. Yeah. Okay. Yeah. We are live. All right. Thank you for joining this discussion, everybody. My name is Cynthia Ng, and I'll be your moderator today. Now, this is an hour-long discussion. We'll be talking about mental health and COVID-19, and we will also be taking questions from you guys. So please drop us a comment on Facebook. Kepada sesiapa yang baru sahaja join diskusi ini, selamat datang. Kami bersiaran secara live di platform Facebook, YouTube, AWANI Live App, dan anda juga boleh mengajukan soalan kepada panel kami yang hebat malam ini. Without further ado, I'd like to introduce our panelists. Professor Dr. Amer Siddiq and he is a consultant psychiatrist at University Malaya. Thank you for joining us. Dr. Beni Rusani, a consultant cardiologist at IGN, Institute Jantung Negara. And last but not least, we have joining us from the UK, Dr. Amalina Bakri, general surgeon specialist trainee at a hospital in London, but she is also a member of Malaysian Health Coalition. I know you doctors have insane work shifts, so I really, really appreciate you taking time, making time to talk about mental health. Why we want to pay attention to mental health is because to fight this challenging war against COVID-19, billions of people have been forced to stay home, to isolate, to social distance. And I think when this hit us, we didn't really have much time to prepare, what more to process. And I believe many are struggling to cope, a million others struggling financially, and this will take a toll on our mental health. So let's start with the latest announcement today, which came from the Prime Minister. He said that, he announced that the MCO will be eased by May 4th, which is next Monday, allowing a large part of the economy to restart so that people can get back to work. But we will be going back to a different kind of normal. So let's start with that, Dr. Amer. Your thoughts on these to ease this lockdown. What do you think? Is it a good idea?
Well, I think, first of all, thank you for having me on Astro. And it's really nice to see my friends, Dr. Amalina and Dr. Beni. Beni, we've not met for 3 years now, so it's really good to be meeting online. So I think, first of all, in terms of the easing of the lockdown, I have to admit that it's a really tough call, no matter which way that you decide, whether to continue or whether to take it off or to ease it. I think the main important thing is for us to understand that the easing of the MCO, it doesn't mean that COVID has disappeared. Mm-hmm. It's very important that we still focus on the enemy, if that's the word we want to use, which is COVID, which is still present within the communities. It's just that we need to, as you mentioned, balance between the financial and economic situation together with the health situation. So, as we move towards normality, we're going to have to do lots of different practices, and we've got to make lots of sacrifices, as we've done currently. But at least this time around, hopefully we're a little bit more prepared in terms of moving forward with what we need to do. We now know that we've got to wash our hands, for example. We now know that we've got to have physical distancing. We now know that we've got to have good cough etiquette. These are the few things that we really need to instill and implement moving forward. And I think with that, then the easing of the MCO becomes just a little bit easier. But at the same time, we've also got to be very cognizant and very aware that at any time, COVID can come back with a vengeance, as we've seen in Japan and also Germany. So I think it's really important for us to move into the easing of the MCO with that in mind. And hopefully that would be, the thing that would be able to make us move forward a little bit better.
And like you mentioned, there is a fear of a resurgence of cases. Hokkaido, you mentioned Japan. In Hokkaido, they were forced to reinstate a lockdown following a second wave of infection. Dr. Beni, your thoughts on it? To prioritize health and economy, where's the balance? How do you feel as a healthcare professional with this decision?
I mean, I'm not an economist, But I can see the point where the government is moving towards, as what Dr. Amer has mentioned. There must be a fine balance between trying to revive back the economy, and at the same time, you want to make sure that people don't get sick. Because at the moment, the first 3 PKP that we've had, so far it looks like it's been doing its job pretty well. However, there are a lot of things that need to be looked at, because as we can see that I think the last few weeks we've been focusing on bringing back people from overseas, students, and now I think this week alone we have been mobilizing students nationwide, going back to their hometown. So I think at the moment there are a lot of things that's going on at the same time. So coming back from that, from the questions, is we really do need to work on this carefully. There's a really fine line here that we need to abide to. People need to be aware to, at the same time, to be able to, keep their social distance, wash their hands, all the good hygienes, so that, we don't have a spike in cases in the next few weeks.
Okay, so the economy side is we are trying to return to normalcy, but how are we coping emotionally, returning to normalcy in terms of mental health? For that, I'd like to get to Dr. Amalina. She is at the epicenter of the virus in the UK at the moment, one of the countries that has taken quite a bad hit from the coronavirus. I believe at this point there are about 26,000 people who have died from the virus in the UK. How are things there at the moment for you, Dr. Amalina? How are you coping?
Yeah, so as of 1st May, there's about 172,000 confirmed cases. And as you mentioned, 26,000 deaths. Despite the huge surge of cases, I think NHS healthcare professionals are doing a great job under tremendous amount of pressure. And after strict social distancing measures were introduced at the end of March in the UK, the overall trend is gradually declining. So yesterday in the daily briefing by the UK Prime Minister Boris Johnson said that the UK has now passed the peak of the disease and the government is currently in the process of planning the exit strategy to ease the lockdown. And the number of people in the hospital being admitted to with coronavirus is also falling. So I'll just give you an overview about my work commitments before and after COVID-19. So before COVID-19, as a general surgeon and specialist trainee and as a PhD research fellow funded by Imperial College London and NHI UK, normally my work is a combination of clinical work, doing on-calls, bringing in operating theatres, and also doing research for my PhD. When COVID-19 reached pandemic, my PhD was put on hold, and my commitment is focused mainly on clinical work, where I'm currently doing 3 times 24-hour shifts on calls, alternate days for 24 hours a week, looking after COVID and non-COVID patients. In the UK, all hospitals are COVID hospitals. Many doctors from different specialties have been redeployed to look after COVID patients, either in the ward or in ICUs. Non-urgent elective surgeries and cases have been cancelled, focusing on urgent cancer cases and emergencies. New temporary hospitals have been built, for example, Nightingale Hospital in London, to accommodate about 5,000 coronavirus patients and also to reduce the burden on the NHS hospitals. When I'm on call for 24 hours a day, I look after 3 wards, combination of COVID and non-COVID patients. A few of my colleagues have been tested positive, unfortunately. And so many staff have to do extra shifts to cover absences. Operating theatres have been transformed into ICUs. And there are a member of healthcare staff who are currently being treated in ICU due to COVID-19. And there are healthcare professionals who have died, unfortunately. A Malaysian-born doctor based in the UK, Dr. Beni Rusani, I'm sure you've seen that on the news,
yep.
Who's consultant neonatologist, passed away recently due to COVID-19. Another Malaysian-born doctor based in the UK, Dr. Tun Muzama Wildan, was admitted to ICU recently, but is now recovering well and he's now back in a normal ward. So it is a very sad time and challenging for all of us. But I think everyone is working around the clock. It is challenging physically, mentally, and emotionally. But I think everyone is very dedicated to their job and stay united to fight this pandemic together.
Do you have a sense of the impact to you emotionally yet? Because you've been working so hard for the past 2 months. How's it like, being stuck in the hot PPE for hours on end? Keeping in mind, of course, once this MCO or lockdown is lifted, there is still a long battle ahead. How are you coping in that respect?
Yeah, I think there is this sinking feeling that you have, because every day when you go to work and see these patients, some of them are critically ill, and the fact that some of them might not be able to see their families again, it is heartbreaking. And as a healthcare professional, you have to be strong in front of your patients, show your empathy and compassion. But even how strong you try to be, you can break down. And it is indeed a difficult time for all of us. I think feeling scared is okay, and uncertainty is definitely challenging. And for us here, there's a global shortage of PPE at present. Alhamdulillah, where I work here, we have enough PPE, but from what I can see on the news, there are hospitals that still don't have adequate PPE. And I can totally understand how worried and stressed the staff are. Also, not being able to see your family and friends is definitely challenging. And if I'm not at work, I will be self-isolating at home. So normally I'll see my mom every year over Ramadan and Eid periods. We'll do Ramadan together. Either my mom comes to visit me here in London if I don't get long holidays, or I visit my mom in Malaysia. So I was planning to visit my mom actually this year for Eid and Ramadan, but due to work commitments, I'm not able to do that. So it is very challenging for all of us. And I think we're all trying to cope as much as we can and trying to support each other through this difficult time.
Now, Dr. Amalina, you mentioned about the lack of PPE, not in the case of your hospital, but tell us about the sense of fear, fear for your own personal safety, fear of infecting other people. And how do you fight through that fear to continue to do what you do to serve?
Yes, just to give you an overview, so far about 100 healthcare workers in the UK have died due to COVID-19, including one of our own, Malaysian, Dr. Vishna Rasya. So based on the UK and international data, indicates that those who have died are mostly from BAME background. So that means it stands for Black, Asian, and ethnic minority groups. And this group are being disproportionately affected by COVID-19 and more likely to be severely affected. There are a few factors that might contribute towards it. However, it is still very unclear, and this is currently being investigated by Public Health of England. I actually had a persistent cough 2 weeks ago, and because it is one of the coronavirus symptoms, I got tested for COVID-19, and alhamdulillah, the test was negative. But a few of my friends and colleagues have been tested positive, and some in ICU. There is fear, and I cannot deny that. And I'm amazed, every time I go to work, of how strong everyone is. We support each other, we look after each other. If someone is not coping, we try to help. And there's real camaraderie between all of us working on the front line. There's also a tremendous amount of support from the hospital, providing mental health support for the staff, as well as support from our own family and friends. And I think what is really making a difference, and it's not something that I have experienced before, is the way that people are coming together to support the NHS. People are cheering and clapping from their windows. Companies are offering amazing benefits. Hotels offering rooms to healthcare workers, fashion designers making PPE, the general public are volunteering to help irrespective of background. So I've seen similar things in Malaysia and around the world, and I thank you so much from the bottom of my heart for all your support and help. And as human beings, we are scared, we are tired mentally, physically and emotionally. However, we are trying to do our best to continue to fight this pandemic together.
All right. I'd like to get to Dr. Amer about coping in this time of uncertainty, probably quite a prolonged time. Of course, drawing from what Dr. Amalina said about healthcare workers at the front line, witnessing tragedy, trauma every day. What can they do if they're not coping? What are the signs to look out for, not just for healthcare professionals, for people at home? Dr. Ami.
Well, I think, first of all, I just wanted to comment to Dr. Amalina for, really being able to survive, if that's the word to use, this current situation that you're in. It sounds really, really scary. And I think this is where I would like to thank the Malaysian public at large because of their discipline and of their support in the MCO. We've been able to avoid some of the stories that Dr. Amalina had shared with us. We don't have that number of deaths, thank goodness, among the population. We don't have that number of deaths among the medical profession. And more importantly, we've not been needing at the moment to use the preparation that we've done in terms of the MAIP, for example, center and the emergency hospital that we've built because of the support of the Malaysian public in staying at home. Now, what Dr. Amalina has shared is what we feel and what we see among colleagues on the ground in Malaysia as well, particularly in the first 2 weeks. Because like I like to share, COVID-19 is a novel virus. We don't know much about it. We were based on the stories of Italy when we started to do our MCO. At that point of time, China had already, I think it was about 2 months through their particular journey with COVID. So there was a lot of misinformation, a lack of information, and also a little bit of a lack of knowledge on our side, most of us, in terms of what to expect. But of course, that knowledge has grown over the last 8 weeks, particularly quickly post-MCO, where initially some of us were gloved up and using masks, and then those who were at the front line started to embark on the wearing of the PPE. But because of this lack of information, the fact that the word pandemic itself is not something that we often use quite often, this caused a lot of emotional distress. And the emotional distress was not only among the population at large who were at home, because they had a different level of stress. The ones on the ground, like Dr. Amalina had mentioned, that were dealing directly with an unknown enemy had a different type of stress. So what the Ministry of Health in particular had actually done at the very beginning is they've actually built a mental health psychosocial support system. And for us in the University of Malaya, we also have the same system where we are targeting those on the front line, addressing their mental health needs through psychological first aid early in the fight of this particular pandemic, at least during the time of the MCO. And then extending that service to those who were affected, i.e. those who were tested positive among the population. And then, of course, those who were working, and then subsequently it went in the community. So as a country, we've done a lot of work in terms of the mental health psychosocial support that has, I think, helped a lot in terms of dealing with some level of anxiety, particularly, and distress among the population. So I think in that respect, we've done some work. It's just that, as you've mentioned, as we move forward in the MCO, now at its 7th week, we're starting to get a bit tired.
Yeah.
And as we're getting a bit tired, a different type of anxiety is starting to build. And this is the anxiety of what to expect next. We are now quite comfortable with being at home. We know what to do now, but what to expect when the easing happens. And the fear is not only for the population at large, as we can see on social media. There are some that are pro and some that are against, and some that are not sure. But it's also for the healthcare providers who have seen the severity of the situation and are now quite happy that it's in a controlled fashion. And we just worry that there might, as Dr. Beni had mentioned just now, a resurgence that might suddenly come up if we are not careful. So that's a little bit of the fear that we're having. But overall, I think most of us are quite, thankful to the Malaysian public for the support of staying at home over the last 7 weeks.
Okay, I'd like to get to Dr. Beni because managing your mental health during this time is as important as managing your physical health and vice versa. So if we look at the number of cases related to death, a lot of them have existing medical conditions, heart disease. These are people with higher risk are at a higher risk from this coronavirus. Let's talk about stress and anxiety with the pandemic, and how could it affect you physically? How does it manifest itself?
All right. Well, stress and anxiety is part of the life, actually. I mean, we all know that, and let's say when we are, when we are at school, when we are sitting for exams, we all feel stress. So there are kind of a good stress for people that sitting for this kind of, stressor situation. But when it comes to something like COVID, when you are stressed, sometimes it will make you feel, how should I put it, the feelings of being scared and being unsure. And it makes your body sort of, they might be able to have a sort of low immune, not in a way that reduce the immune system. What I'm trying to say is they make their body unwell. So that is putting a lot of stress to their body internally. So these are the kind of bad stress that we should be avoiding. So I think what is important is for you to be able to get to know yourself better. Now you should know what kind of stress level that you can handle and what you cannot handle. So it is very important to be able to know what tick you off and know when to find help. Because if you wait for too long, before we get help from other people, then it might be too late. So it's better to have a good social support, like people with families, people with friends and colleagues. So open up and talk to them what worries you, because sometimes just by speaking to people will help to reduce our stress level down.
Okay, now we're getting some comments on Facebook. Saya nak bacakan komen yang kami dapat dari Facebook ya. Hakim tanyakan, macam mana nak kekal tenang kalau kita pun tak boleh jangkakan apa akan berlaku di masa hadapan. Berbalik kepada komen Dr. Amer tadi about the uncertainty. Mungkin dari aspek tersebut, apa saranan Dr. Amer?
Okay, so yang penting dari segi sini yang kami selalu tekankan dan telah pun dilihat dari segi komentar daripada astronaut NASA juga semasa diorang terpaksa PKP, consider PKP di angkasa untuk berhari-hari ya. Yang pertama, kita memahami bahawa semasa isu PKP ini ramai orang kehilangan kawalan dari segi autonomi terutamanya. Tak tahu apa yang hendak dijangkakan. Maka kita perlu mengambil balik kawalan tersebut. Dan salah satu cara yang paling senang yang kita perlu lakukan adalah dengan mengadakan satu rutin. Rutin harian sangat penting. Malahan macam saya kata tadi, astronaut dari NASA pun mengatakan bahawa antara benda-benda yang menyebabkan mereka boleh maintain kesihatan mental mereka di angkasa sana berhari-hari adalah dengan ada satu rutin yang jitu yang kita terapkan dan kita amalkan dengan sebaik-baiknya.
Okay, Doktor. Okay, let's stop you right there for a while. Rutin tu dalam tempoh PKP wajar dilakukan, tapi melihat kepada penurunan trend kes COVID-19 dan pengumuman PM hari ini bahawa MCO akan dilonggarkan, rasa bimbang tu mengenai masa hadapan. Okay. Yep. Contohnya mereka yang hilang pekerjaan akibat pandemik COVID-19. Mereka yang mungkin rasa was-was nak keluar rumah. Benda-benda macam tu yang kita tak pasti lagi apa akan berlaku. Bagaimana pula dengan golongan tersebut?
Sama juga dari segi untuk mengurangkan rasa kerisauan. Okay, pertama kali adalah kita memang dah jangkakan bahawa kita akan rasa risau semasa kelonggaran PKP ini. Ya, itu yang penting. Tetapi seperti yang tadi Dr. Beni mengatakan bahawa ada mereka yang dapat menahan stres mereka, tetapi ada juga yang tidak dapat menahan stres mereka juga. So yang penting untuk kita nak melangkau ke norma baru ini adalah dengan kita bersedia akan apa-apa yang perlu kita sediakan. So ada benda yang kita boleh prepare. Contohnya bila kita nak masuk ke kerja, apakah yang kita akan buat semasa kita mula bekerja, bagaimana kita nak mengatur cara kita semasa kita bekerja. Contohnya ya. Kita tak main langgar je contohnya. Kalau kita dah tahu maka kita akan balik ke kerja, maka kita akan cuba mungkin jarakkan sosial, pastikan bahawa tangan kita bersih, pastikan bahawa kalau kawan kita batuk kita kata kat dia tolong pakai mask contohnya. Kita dah ada set begitu. Di sini juga kita memerlukan sedikit kepastian juga dari segi apakah kerja kita masih ada lagi, adakah bantuan untuk kita ada atau tidak. Dan inilah yang saya rasa program prihatin sama ada di pusat ataupun di negeri-negeri adalah untuk membantu mereka ini untuk mendapat sedikit kepastian supaya uncertainty tadi tu tak melampau. Sama juga kita dengan ada perbincangan pada hari ini adalah untuk kira macam nak membantu rakyat Malaysia supaya mereka bersedia memandangkan kita telah ease of the MCO ataupun longgarkan sedikit PKP ini. Maka kita semua dalam satu situasi hendak mula balik ke normality. Tetapi kita peka bahawa normality itu tak akan jadi macam dahulu lagi. Dia adalah norma baru yang kita kena lagi cepat kita mengambil maklumat ini dan kita terima situasi yang kita akan ada depan akan datang ini, maka lagi senang kita untuk stabilkan sistem homeostasis badan kita supaya stres yang tadi Dr. Beni bincangkan tak berlampau dan menyebabkan kemudaratan untuk kita.
Okey, saya nak ke Dr. Amalina sebagai seorang frontliner, bukan sahaja perlu bekerja keras, bekerja tempoh yang lama tetapi tak dapat nak jumpa family, orang kesayangan. Sudah tentu ia satu impak terhadap emosi dan mental juga. Dan saya ada soalan daripada Sasha yang bertanyakan sama ada counselling diberikan di hospital untuk membantu para doktor dan para jururawat untuk to prevent burnout. Is there such assistance?
So dekat di UK sendiri memang ada hotline number yang pekerja kesihatan boleh panggil untuk mendapat nasihat dari segi support, advice and counselling. Dan di hospital tempat saya bekerja ada drop-in sessions yang kami boleh pergi untuk mendapatkan bantuan, dan juga sekiranya ada masalah yang perlu buat further investigation, yang perlu further psychological support, dan kami boleh mendapatkan bantuan daripada supervisor dan line manager from the hospital. So adalah bantuan yang diberikan kepada petugas-petugas kesihatan di hospital. Bagi saya yang pentingnya perlu ada kerjasama secara pasukan. Jadi apabila ada orang yang rasa stress, maybe they're not coping when they're at work, so kita perlu saling bantu antara satu sama lain, cuba untuk berasa simpati dan membantu mereka untuk mengharungi cabaran yang kita ada sekarang ini.
Okey, saya ada lagi satu soalan untuk Dr. Amalina daripada viewer kita. Kalau susah nak ingat atau fokus banyak perkara masa PKP ni, adakah ini tanda masalah mental?
Oh, that's a good question. Probably, I think Dr. Amer is to answer that question. I think the lack of being able to focus is, there are lots of different reasons why you can have this. Ada banyak reason kenapa berlaku benda ni. Ada salah satunya mungkin anda tak cukup tidur ataupun tak cukup berehat, atau anda terlalu fokus, contohnya menggunakan banyak gadget-gadget macam menggunakan phone ataupun iPad, and spending too much time on the internet. So ada banyak faktor kenapa boleh menyebabkan anda tidak mendapat untuk fokus untuk membuat kerja. Tapi bagi saya, kalau saya di hospital bekerja, selainnya adrenaline rush yang membantu saya untuk fokus, dan juga minum kopi kadang-kadang bantu juga. Tapi selalunya sebab bila saya bekerja 24 jam on call, you have to be ready whenever there is an emergency, and you have to be on the go all the time. So dah biasalah rasanya untuk doktor-doktor macam Dr. Beni dan Dr. Amer, memang dari kami belajar masa di universiti lagi sampailah sekarang bekerja training sebelum ni, dah kebiasaan untuk membolehkan kami boleh fokus apabila bekerja terlalu panjang waktu lama. Tapi rasanya untuk mereka yang berada di rumah, cubalah cari cara yang paling sesuai untuk membantu anda untuk fokus. Contohnya cuba jauhkan diri sekurang-kurangnya rasanya 1 atau 2 jam daripada gadget sebelum anda tidur. Jadi bila anda bangun esok paginya, anda akan berasa fresh. Dan mungkin Dr. Amer juga boleh tambahkan lagi banyak extra points lain daripada segi mental health dan juga
saya ada satu lagi soalan untuk saya rasa ini memang diajukan untuk Dr. Amalina. bagaimana ya doktor menjaga mental health pesakit yang telah disahkan COVID-19, kerana bukan sahaja mereka akan terkesan dari segi fizikal tetapi juga dari mental, aspek mental, kerana mereka ni ada yang di stigma kerana membawa virus tersebut, dan kita juga pernah lihat kes-kes witch hunt di social media untuk mencari kes yang menyebabkan sesuatu kluster di satu tempat ya. Jadi Dr. Amalina, bagaimana menjaga the mental health of the patient?
Sebagai seorang doktor, saya cuba untuk menunjukkan simpati, empathy, compassion apabila bercakap dengan pesakit-pesakit. So it is our duty to make sure that our patients feel at ease apabila kami berjumpa dengan pesakit-pesakit, bertanya bagaimana keadaan mereka, bagaimana kesihatan mereka, bagaimana adakah mereka dapat cope dengan masalah mental, dan rasanya the best way to approach this is by showing your empathy, by showing your sympathy. Every time you go to see your patients in the hospital, in the ward, during a ward round, you just have to be like a normal human being. It's not like a relationship between a doctor and a patient. It's more like a relationship between another human being to another human being. So as long as you can, show your empathy, your sympathy to other people, I think that will be fine.
Okay, I'd like to get to Dr. Beni. There is a question from Encik Rusni Zam. Hi doctors, many Malaysians have been working from home since PKP and it's uncertain when this will end. Can you share your checklist to support mental health during this time? And then I believe there's a lot of doctors as well who are at this point in time who are perhaps not at the front line. They are also taking perhaps a step back from going to the hospital. If you can share with us that experience. And for you personally, Dr. Beni, how has that impacted you?
Okay, so basically, I'm working in IGN, and IGN is not one of the COVID hospital. So because of that, we don't really see COVID patients on day-to-day basis. But how IGN function is that we do accept cases that has cardiac complication. So patient with COVID from other hospital, like from HKL or Sungai Buloh, for example, they may have a patient with COVID that has, heart attack. So they will send those patients to us. So these are the kind of patient that will eventually end up being admitted and treated in IGN. So when that happens, of course, we, take all the precaution that, like in other hospital. So we gown up, don the face mask and face shield and everything. And then we treat them, as like per other patient, because most of these patients with COVID, they actually need a support treatment, more like oxygen, drips and whatnot. So basically, when it comes to, sorry, what was the question again? I kind of
well, basically, how are you coping as a healthcare professional? Perhaps I just got this very interesting question directed to you, Dr. Beni. Bila duduk rumah kadang-kadang rasa sesak nafas, pening kepala, hisap rokok banyak sampai rasa paranoid. Jadi lepas tu nak keluar jogging pun tak boleh sebab PKP. Semakin mental comment ya. Mungkin Dr. Beni ada nasihat kepada saudara hakim yang rokok banyak sangat sampai rasa pening, paranoid.
Question I'm very comfortable to answer, because when it comes to health psychology and psychiatry, I think Dr. Amer is the best person. But speaking as a cardiologist, we know that smoking, vaping, all these substance, they all have a stimulant effect. So what a stimulant do? They will make the heart beat faster. Your blood pressure goes higher. So in a way that you are driving your sympathetic reaction, is kind of our sistem saraf kita bekerja overdrive. So people can have palpitation, they can have chest pain, they can have breathlessness, they can have palpitation, or even lightheadedness. So, and if you read medical textbook, you will find out that these symptoms, the one that I mentioned here, is classic symptoms for heart attack. So people got, they got over anxious. Then they will ask themselves, am I having a heart attack? Or am I having anxiety? Or am I having, very severe stress? So it's very hard when it comes down to those. But what I'm trying to say is, if they are not sure, please do come to hospital and, come and to the emergency department. Because the only way to to diagnose a heart attack, untuk mendiagnose serangan jantung adalah melalui beberapa ujian seperti buat ECG, cek darah mereka, jika darah enzim jantung mereka meningkat, dan ini baru kita tahu yang mereka ada heart attack. Tetapi apa yang saya bernasihatkan bagi mereka yang suka mengisap rokok ataupun vaping, cuba try wind down, because those substances are not going to help you. It's not not going to reduce your stress level. So try to find other means to reduce your stress level, because Dr. Amer here probably could tell us more that people yang melakukan yoga atau melakukan deep relaxation breathing also will bring their stress level down. And I think it's good news today that I think from our PM checkup, nowadays the people can go jogging kan, secara bersendirian lah, jangan pergi
kurang daripada 10 orang.
Ya, jangan maximum. So in a way, this is a very good way for people to distress. But I need to tell people out there that whenever you want to jog out there, just try to be careful not to get too close to the person ahead of you, because I think there are some research to say that when there are people jogging in front of you, they might cough, and that cough or droplets, that virus, if they have it, might stay there just in place at the right time when you're crossing their path. So just be careful.
Okay, we're talking about managing mental health as an adult. I'd like to touch on kids as well, students especially. Those who are really trapped during this time of MCO are really the kids, because they can't go out, they can't go to school. I have a colleague who just told me this afternoon to say that setakat nak bawa dia pergi buang sampah kat luar rumah sahaja, itu tempat yang dia bawa kit je sebagai satu a form of distraction, because kids want to play, students want to have socially to interact, right? So I have a question from Aisha about to Dr. Amer about how students are having burnout from online learning, and as well as for those who have to juggle housework, taking care of a sick mother, or to study and work at the same time. Sebab kalau kat rumah tak semestinya tak kerja, juga kerja mungkin lebih banyak sebab you don't have that a fine line between work and play, or work and rest, right? Because you're at home and you want to work in this time of COVID-19 as well. So Dr. Amer, what are your comments?
Okay, so first of all, can you guys hear me? That's the first thing.
Yes, we can hear you.
Because for some reason my computer suddenly decided to turn off midway. But okay, so first of all, we understand that children particularly are one of the people that will be at risk during this period of time as well. So what we have done in University of Malaya, particularly UMCAS, we've worked with UNICEF under the Kita Connect program that you can get on Telegram, to actually support children for their mental health specifically. So within that particular ecosystem, there are videos, activities to build resilience, which also allows parents to have certain activities for their children as well. So this is one of the methods that we've actually worked together with UNICEF to assist the problem that you've just shared. And secondly is that kids need a set of routines, and I think we need to be, again, similarly, just like us, they need to have activities. At the very beginning of the PKP, there were lots of talks about setting up various activities for your child over the course of a month, so that they're always consistently, active with activities at that point of time, including both physical and learning activities as well, reading and what have you. So, and the only thing with children is that you've got to make it variety. You've got to have a variety of activities as well for them. So this is one of the methods that we've actually helped. Now I understand that as you've shared, parents are feeling the strain because they are juggling multiple roles as a parent, mother and father, as a husband and wife, and also as a worker. Especially if they're working. So I think the most important, again, advice that we can give to all these working parents, including ourselves as well, is to what we call maintain self-care. Again, there's a lot of research, particularly published by colleagues. There's one particular work that was published recently in the Lancet talking about self-care being one of the most important activities that you can actually develop during the MCO, which you'll need to continue post-MCO in order to maintain your mental health. And self-care activities that actually that you enjoy doing, that are purposely done to actually maintain some level of physical spiritual or psychosocial level of wellness. So this is probably some of the advice that we can actually give mom and dads and people out there.
Okay, we're getting quite a lot of comments. I'd like to get to Dr. Amalina now, because while we're waging a war against COVID-19 in real life, there is also a lot of negativity and things online. And I think Dr. Amalina will be perfect to answer this, because you are very active online to in a way to talk about science, medical facts to support basically to tell people what's to dispel misinformation, okay, if I can put it that way. But at the same time, with more people spending time on social media, we have seen an increase of hateful comments, okay? And why is this happening, and why this need to direct blame to a group of people, and how do you deal with online bullies, which could affect
you? So yes, I do agree with you. So more people spend time on social media, and there's a lot of cyberbullying, stigmatization, and xenophobia. I actually have personally been bullied and harassed on social media, and I think it is not okay. I have received multiple threats, including death and rape threats. People need to remember that each and every one of us on social media, including myself, is a real person. We are normal human beings. We have feelings, we have families. I cannot deny that sometimes I was hurt. However, I cannot control how people feel about me. I'm here to, to educate, to create awareness on social media. It's an evidence-based medicine. And I always try to rise above it. And always try to channel that negativity into something positive, and motivates me to even work harder to achieve my goals and ambition. As Michelle Obama said, when they go low, we go high. And also there's a pepatah Melayu yang mengatakan tak hidup dipuji, tak mati dek keji. So I also receive a lot of social support from, especially from my mom, who's been my biggest motivator, my family, my friends, my colleagues, and also to my followers who have been very lovely, sending me lots of wonderful messages online. I pray that Malaysians will always spread kindness and positivity on social media. Some people have been spreading lies and hate about me on social media, whatever the intention is, either malicious or with political motivation. I hope that they will stop. I'm here as a doctor. I give advice based on evidence-based medicine. I don't support any political parties or any movement. I don't want to be used as a scapegoat for anyone's political debate. Believe me, if this gangster mentality, trolling and cyberbullying on social media continues, it is going to destroy our young Malaysian talents who are trying to do good to the rakyat, especially during this holy month of Ramadan. Let's just be kind to each other.
Okay, Dr. Amalina, mungkin ada nasihat kepada mereka sekiranya mengalami rasa stres, terlalu banyak melihat berita-berita yang mungkin memberikan rasa sedih, dan juga seperti yang Dr. Amalina katakan tadi, cyberbullying, trolling. Apa nasihat kepada mereka?
Nasihat saya kepada mereka yang pernah mengalami cyberbullying or trolling, ignore the comments. Cuba salurkan yang negatif itu kepada something yang positif. Always think positive. Always think that what you're doing is you're trying to do something good to people, and believe that you're here to make a difference. And also, if you're struggling, speak to your friends, your families, your parents, get a good social support. And I think if you have all of this, around you, all this positivity around you, I think you will be able to, cope with it. I think that's what I do normally. Saya cuba ignore apa-apa saja perkara yang negatif di luar sana. Yang saya tahu, saya ingin membantu rakyat Malaysia walaupun saya berada jauh di negara UK, but I am still a Malaysian. I will always be proud to be a Malaysian, and I will always help whenever I can from afar. And especially now because I'm doing my PhD and I'm still doing my specialization training in general surgery. But I would like to help with the advancement of technology using my social media platforms, to help. And also, I'm also part of an NGO called Malaysian Health Coalition. So with this NGO, basically, there are lots of different medical associations, for example, Malaysian Medical Association, Academy of Medicine of Malaysia, and also a few individuals involved, for example, Dr. Christopher Lee, Yang Amat Mulia Tengku Iman, one of the daughters of Yang di-Pertuan Agong. And our aim is to support the Malaysian government to provide the best pandemic response based on evidence-based medicine. And my task is to help create public health awareness, like what we are doing here today with Astro AWANI, to support the rakyat via social media platforms. So I'm just trying to do my best to help.
Okay. Now, speaking of social media platform, mungkin soalan ini saya nak ajukan kepada either Dr. Amer atau Dr. Beni, kerana tak semua orang ada akses kepada kesihatan mental. Mungkin tak ada akses kepada live stream ketika ini yang apa yang kita bincangkan. Bagaimana kita nak reach out kepada golongan yang mungkin marginalized, yang kurang mempunyai akses terhadap perkara-perkara macam ini? Dr. Amer mungkin?
Yeah, so I think ini satu soalan yang memang sangat bagus, Cynthia, dan saya pun terfikir-fikir terutama dalam semasa PKP ini, memandangkan kita faham bahawa ada yang ada akses kepada internet dan ada ramai yang tak ada akses. Dan saya rasa satu cara yang kita boleh majukan ke hadapan adalah dengan penggunaan mungkin kepakaran-kepakaran dari pihak universiti terutamanya. Ada satu program yang dipanggil University for Society yang baru nak dilancarkan, tetapi lepas tu MCO terjadi. Tapi saya rasa dalam University Society itu ada 22 universiti di seluruh Malaysia yang semuanya ada jaringan industri dan juga masyarakat. Dan di situ saya rasa universiti-universiti tersebut boleh bergabung tenaga dan juga akan melakukan aktiviti-aktiviti bersama komuniti secara on the ground. Jadi kita faham bahawa seperti yang Cynthia mengatakan bahawa ada yang tak ada akses kepada social media. Dan kita tahu bahawa walaupun social media itu bagus, tetapi dia juga ada kekangan dan limitationnya. So saya rasa masih lagi perlu. Dan kalau kita lihat dari segi pengalaman di China, di China semasa COVID mereka juga, bukan sahaja mereka menggunakan social media, tetapi kalau you tengok gambar-gambar, dia ada guna kain rentang tu, supaya orang tahu bahawa apa nak buat, walaupun dia punya country is very techno savvy, tetapi masih lagi because dia take into consideration bahawa ada orang yang tak ada akses pada social media. Sama dengan New Zealand, semasa dia masuk ke dalam PKP ni sebulan yang lepas, semasa dia mewar-warkan dari segi media sosial dan juga media massa, mereka juga menerbitkan bahan-bahan fizikal juga supaya diberikan kepada rakyat yang mungkin tak dapat akses. So saya rasa kita mungkin perlu peka akan semua aspek ini dalam kita punya program menuju ke hadapan. Dan saya rasa ada kemampuan di situ dari segi agensi-agensi yang sedia ada supaya kita dapat membantu mereka yang tak dapat maklumat yang Amalina dan juga Dr. Beni katakan tadi.
Okey, dalam norma baru ketika ini, we were going back to a very different world dan juga melihat kepada environment di tempat kerja yang biasanya kalau nak katakan stres tu kebanyakan dia datang dari kerja kan. Jadi mungkin soalan kepada Dr. Beni, bagaimana kita nak melaksanakan new normal environment di tempat kerja supaya kita boleh kurangkan tekanan tersebut dan juga kurangkan impaknya kepada mental dan juga fizikal. Mungkin ada cadangan dari Dr. Beni.
Jadi macam di institusi negara, apa yang kita buat adalah kita tengok pada workflow kami. Workflow di mana kita lihat di mana pesakit bila datang ke hospital, kebiasaannya majoriti adalah berjumpa di klinik pesakit luar, di klinik kardiologi. Jadi kita pastikan bahawa kita menjaga mereka supaya jangan berada hampir di antara satu sama lain. Contohnya kita membuat garisan di atas lantai, kita menjarakkan kedudukan mereka dan juga bila masuk ke dalam klinik walaupun kerusi mereka itu agak sedikit jauh daripada kerusi nurse ataupun doktor. Di mana kami boleh bertanya soalan tetapi jarak tu masih dalam 1 meter jauh ya. Dan konsultasi dilakukan secara biasa. Tetapi jika perlu memeriksa pesakit, dan kami akan pergi dan memeriksa sekejap dan kemudian pulang semula ke kerusi. Jadi di situ kita boleh memastikan sejauh mana yang boleh kita memaksimumkan, kita meminimalkan kontak dengan pesakit yang perlu. Lagi satu apa yang kita perlu mungkin lihat adalah setting di hospital di mana kemungkinan ada konsultasi yang boleh dilakukan secara online. Dan ini masih lagi dilakukan kajian di mana kita tidak perlu berjumpa dengan pesakit secara fizikal. Dan kita boleh melakukan secara online seperti apa kita buat sekarang ni. Dan pesakit berada di rumah, kita berada di hospital, kita boleh bertanya khabar dan bertanyakan pasal keadaan mereka. Jika ada beberapa perkara yang mungkin perlu diselidik dengan lebih rapi, kita boleh membuat appointment supaya mereka datang ke hospital. Ataupun jika mereka jauh daripada KL atau di Perlis katakan, mungkin rujukan boleh dibuat di hospital yang berdekatan dengan tempat mereka.
Okey, ya itu adalah langkah-langkah secara physical social distancing. Tapi dari segi langkah menangani impak pandemik COVID-19 terhadap kesihatan mental, adakah wujudnya satu mekanisme yang coordinated dari sudut polisi ataupun negeri yang sudah ada wujud inisiatif untuk menangani benda ini?
Ya, ni mungkin saya boleh membantu sedikit. Yang pertama, saya rasa yang penting yang kita mengadakan perbincangan hari ini adalah juga untuk isu yang ini. Dan telah ada pun dari segi some companies dan juga beberapa agensi dan juga negeri yang sedang memikirkan aktiviti-aktiviti dan polisi untuk menangani isu pasca COVID, pasca MCO. So seperti kita tahu daripada segi kajian mengatakan bahawa the next problem after this infectious issue is going to be mental health, because as we discussed at the very beginning, it's going to be related to a little bit of the econs. Because semua negara macam di UK seperti Dr.Amalina cerita tadi, kita berada di Malaysia ini dan juga negara China contohnya, we are in a different stages of the COVID pandemic. So the situation at each country is going to be different, but the economic issue is probably going to continue for quite some time. And we've already got reports from World Economic Forum that the next issue is going to be mental health.
Right.
And I think what is important for us is to take note that moving forward, as we improve the infectious disease aspect, we start to focus on the mental health aspects. And some companies have already started doing this, Cynthia. They've already started to engage with us in terms of how can they respond to their people coming back to work that might have trouble with the new normal that we're facing at the moment. Yeah, how are they going to support colleagues that might need to take a pay cut? Because this is the reality that's going to happen later on. And I think what's important is that we're having this discussion to acknowledge this fact. And because we have this acknowledgement, therefore activities will come in place over the coming months. Kita baru nak longgarkan sahaja PKP ini. Kita bukan nak off lagi. Kita baru nak longgarkan sahaja. Dan kita akan lihat dan selidik dan teliti apakah mekanisme-mekanisme yang perlu kita buat balik untuk membantu supaya isu-isu yang akan datang itu dapat ditangani dengan lebih elok.
Okay. I'd like to get to Dr. Amalina because we know that this is going to be a protracted battle. It's going to be here with us for a long time, this virus. Are there similar initiatives like what Dr. Amer has mentioned in the UK NHS to provide that kind of support to healthcare workers like you?
Yeah, I think what Dr. Beni has also mentioned before about telemedicine, I think that's probably going to be something that's a new normal for us, maybe at some point later on in the future, where GPs are encouraged to do consultations via online or by the phone, and if we can, try to reduce as much contact as possible physically. And also because the fact that I mentioned before, the BAME background healthcare professionals are more likely to be affected by coronavirus. So I think the UK government is currently trying to do some investigations, trying to find out what's the best way to do risk assessments to try to prevent unnecessary death for healthcare workers from this BAME background. So that's another thing that they need to look into. And other things is with regards to temporary hospitals, like Nightingale Hospital. So I think the government is planning to continue the operations of this hospital, even though they're not fully, the capacity to accommodate is about 5,000 patients, but we're not using it fully at a full capacity at the moment because the NHS hospitals are still coping and we still have enough beds in ICUs and also in hospitals. But if, say, we have another outbreak, another surge of cases, then we need to make sure that we have that measurements in place to make sure that we can cope with it when it happens again in the future. So I suppose I'm not sure about what Malaysian government is doing, but I suppose Dr. Amer can give more details about that.
Okay. Well, I unfortunately I have only 4 minutes left of this discussion. There is one question from Erica who asked about this anxiety, the palpitations that has occurred while being under lockdown during MCO. Will it last? Will this last for a long time? Maybe we can start with Dr. Amer.
So the answer is going to be yes and no. For some people, it might be a start of another problem. For many others, it's probably just temporary during this particular period of time. There was a research that was just published by the Center. You can check it out at thecenter.my, looking at the levels of anxiety, depression, and stress during this period of time. And what we've noticed is that in the people that we've actually sampled, the majority of us, or at least half of us, were having heightened levels of arousal or stress compared to a normal situation. And it's also dependent on, and this particular study was done in two parts. One was looking at space, living arrangements. Second was on finance, yeah? So, there are factors that might increase the level of stress, but overall, people were feeling stressed during this period of time. Now, majority of us will probably, the stress will go away as we go back to normality, but there'll be a small population of people that might need a little bit more help moving forward. Okay. So just rest assured that you'll be the majority rather than minority.
Okay, with a couple of minutes left, I'd like to get to each one of you about ways to de-stress. How do you cope? How do you relax? These times of so much uncertainty and morbidity. Let's start with Dr. Beni. What do you do, and what are your advice to people?
Do what you like. Do what you enjoy doing, so that everybody have different way of distressing. So like I sometimes I watch K-pop drama like so that kind of a distress me a little bit. But everybody have their own ways and mechanisms to distress. Like talk to your parents, talk to your friends, loved one. Or maybe you want to. It's a good time to sit down, write a blog to open up your feelings. And, a little bit of things will help you along the way.
Okay. Well, I just got a cue from my director, producer, that we have 10 minutes more to go. So we got extra 10 minutes. Okay. But nonetheless, let's just get to Dr. Amalina as well. Working in such high stress environment, how do you tune up? Can you tune up once you get home?
Yeah, so on my off days, I try, obviously on my off days, I have to be self-isolating at home. So maybe sometimes I just use that time to watch Netflix or Amazon Prime, try to wind down a little bit. And also, because I have my own blog now called Amalina website. So I'll try to spend some time writing for that website as well. And on my other days when I'm not working, and I try to continue doing my research and also research related to COVID-19. So I think that's also my way of trying to wind down a bit. In a way, I don't know. I just love reading. I just love learning new things. So and also I speak to my mom almost every day. So speaking to my mom, even just on FaceTime, just having look at her face every day. It's giving me the support that I need every day to continue with my days every day.
So actually, I have one question before I get to Dr. Amer about what he does to de-stress. All three of you have very strong following on social media. This is what drives you to be so active? The reason why I'm asking is because apart from the adoration that you get from your fans, there's a lot of hateful comments and a lot of negativity, and this will impact mental health as well. So maybe I'll start with Dr. Amalina. What drives you to do this despite the so much negativity that you find online?
So as I mentioned before, I mean, I have been on social media for a few years now, and the reason why I'm here is to essentially to help create public health awareness based on research evidence. There are lots of medical misinformation out there, and it's difficult for people to tell which one is the truth, which one is false. And so my task or my aim is to help my fellow Malaysians to understand current health issues based on evidence-based medicine. So I regularly do live sessions on Instagram and Q&As on Twitter to discuss about health issues, and also have created my own website called Astro Amalina to help my followers to understand, what about what's going on. They can ask me questions, and I'll be able to then, answer whatever that's necessary. So my presence here is merely to help to share my knowledge, and because I feel like whatever that I learned here, I feel like I need to share it with everyone else on my social media platforms. The fact that I have a lot of followers, I just want to use it to do something good to people, because I think it's just my one way of giving back to the community from whatever that I learned in the UK that I want to give back to the community.
Okay. Now, Dr. Amer, when this outbreak occurred, this is a new virus, so there were lots of rumors, misinformation running rampant online. For somebody who is seeking information online, but at the same time to protect one's mental well-being by not being bogged down by all this too much information negativity, what would be your advice to them?
Well, my advice would be to follow the relevant authorities. So we did quite a lot of advocacy at the very beginning, that you follow WHO and the Ministry of Health in order to get the right information, and you just zone out from the rest. If you're feeling that it's just overwhelming. I believe in information empowering, but I do know that if you have too much information, it can be disempowering and disconnecting. So for those who feel the latter, it's probably better for them just to connect to the two more important. For example, in Malaysia, it's going to be CPRC on Telegram or the Ministry of Health websites or their channels. And then, of course, if you're wanting more international flavor, then the World Health Organization probably is the way to go. And then just stop it there, because whatever you're going to get is going to be related to those two particular big bodies, at least for this country.
Okay. And Dr. Amer, let's get back to you about relaxing and how, as a consultant psychiatrist, what would be your way, to deal with the mental stress and the uncertainties that we're facing right now?
Well, okay, so I've got a whole set, quite fixed set of routines in order to maintain some level of normality. So, making sure that you sleep well, that you eat well, that you do some level of physical exercise. That's quite important. I concur with my two colleagues. I actually have a self-care routine as well, and I try very hard to stick to it. I've gone back to manuals. So I've got a pen and a notebook, and I do quite a bit of my writing and thinking on that. And I've also started to employ lots of relaxation exercise and techniques. Mindfulness being the latest one, looking at all four senses at least. But basically, these kind of activities are the ones that I'm using at the moment to decompress and de-stress.
Okay. Now, before we part ways, it's Ramadan month, and we would like to hear from you, ucapan Ramadan from our panelists to our viewers. Maybe we could start with Dr. Amalina. Mungkin ada ucapan untuk peminat-peminat rakan-rakan di Malaysia dan di serata dunia.
Saya ingin mengucapkan selamat menyambut bulan Ramadan, dan juga selamat menyambut seterusnya ada Fitri nanti bila bulan Mei, dan saya harap kamu semua dapat spend this time to recuperate from everything that's been going on. And then juga kepada my mom, I love you so much. I'm sorry that I can't be there with you during Ramadan and Eid, but I love you, and I really, really hope that I will see you soon when this is all over, very soon, hopefully.
Dr. Beni?
Okey, saya ingin mengucapkan selamat berpuasa kepada semua rakyat Malaysia yang menonton, dan juga kepada mereka yang follow saya di social media, dan tak lupa kepada ibu bapa saya di Kuantan, Pahang, mak abah, minta maaf tak dapat balik tahun ni, insyaAllah tahun depan. Dan kepada mereka yang berada di luar sana, jagalah kesihatan. Jangan, ini satu pesanan yang saya nak sampaikan. Kadang-kadang ada di antara mereka di luar sana yang keberatan hendak ke hospital kerana mereka rasa mereka tak nak membebankan frontliner. Mereka kata, ubat dah habis, mereka tak nak datang. Tapi sebenarnya mereka perlu datang. Jangan tangguh dan jangan lengah. Kerana jika mereka tangguh dan lengah, mereka mungkin akan mendapat penyakit lain yang komplikasi seperti yang kita katakan ini, collateral damage. Mereka yang tak ada COVID tapi mereka mendapat terkesan daripada tak datang ke hospital. Terima kasih.
Dr. Amer?
Yang pertama ingin mengucapkan juga selamat berpuasa. Nak kata selamat Hari Raya kita di sini ya. So kita nanti insyaAllah jumpa lagi kot Cynthia ya. Tetapi kepada semua yang penting jagalah kesihatan mental masing-masing. Semasa kita nak menuju ke pasca MCO dan juga ke normal baru, memang isu kesihatan mental akan meningkat. Maka ambillah peluang ini untuk belajar sedikit mengenai cara-cara untuk menangani stres terutamanya. Juga di bulan puasa ini pada yang beragama Islam, ini masa yang paling elok untuk kita buat self-care spiritual juga. Ya. Spiritual health juga penting kepada kita dan memandangkan situasi normal baru ini. Kalau kita perhati daripada satu ucapan yang kita dengar tadi pagi bahawa mungkin sembahyang berjemaah contohnya masih tidak dapat dilakukan, maka kita ambil iktibar daripada situasi sebegini supaya lain kali bila masuk ke tahun hadapan insyaAllah kita lebih bersemangat untuk melakukan aktiviti-aktiviti mungkin yang kita tak dapat lakukan pada tahun ini. Saya rasa itu sangat penting juga.
Okay. Baik, terima kasih kepada semua panelis untuk diskusi malam ini. I really appreciate you making time for this, talk about mental health. I think it's a very important conversation as like you said, there will be an increase of mental distress and anxiety during and after this, if this ends. I think it's going to still be quite a long way to go. So I think we should continue to have this conversation, and I appreciate you spending time with us. Terima kasih kepada semua penonton yang menyertai diskusi ini, dan sekiranya anda ada pandangan ke cadangan ke nak buat topik lain, boleh ajukan kepada kami di Facebook, di YouTube. Dan untuk seminar seterusnya, sebenarnya kita ada satu lagi seminar pada 6 Mei Rabu depan pada jam 10 pagi di mana kita akan membincangkan normal baharu, embracing a world of new normal. Ada 3 panelis yang akan join diskusi itu. Serena Syukri dari CEO MDAC, Najib Ibrahim merupakan pengarah urusan Cyberview, dan Dr. Madeline Burma dari Akademi Sains Malaysia, dan akan dihostkan oleh rakan tugas Nazri Kaha, dan oleh itu anda boleh saksikan pada 6 Mei jam 10 pagi. Okay, once again, done my pitch. I really appreciate you guys, and I hope to maybe perhaps meet in person one day once all of this is over.
Yes, thank you so much, Cynthia. Thank you, Astro.
Thank you, Cynthia. Thank you, Astro.
Ciao. How do I leave this?
Alhamdulillah.